Chapter 2, Urinalysis. The foundation of urology is urinalysis. Without a thorough practical familiarity with this art, as practiced in the laboratory and in the clinic, no man may expect to diagnose diseases of the urinary organs. The practice of urinalysis is twofold: laboratory urinalysis and clinical urinalysis. Laboratory urinalysis. In the laboratory, the urine is subjected to test for acidity, specific gravity, albumin, sugar, indican, etc. It is centrifuged and the cellular, crystalline, and bacterial content of the sediment noted. Such an analysis every physician must be competent to perform. There is no special need, therefore, to dwell upon it here, except to insist upon certain points of peculiar interest to the urologist. The selection of the specimen. This is of the greatest importance. Unless the patient's general health and the examination of a single specimen warrant the belief that the kidneys are sound, a 24-hour specimen should, of course, be examined. But this is not enough. The urologist is chiefly interested in the bacterial and cellular content of the urine. This he wishes to examine without contamination, if possible, by the secretions of the urethra or of the vagina. Hence, the specimen for microscopical examination must be obtained direct from the bladder. To accomplish this, it is best to draw the urine by catheter, though sometimes it is sufficient to have the patient urinate into 2 glasses, as described below, and to examine the contents of the second glass. This precaution is even more useful for the analysis of the urine of women than of men, though this is not generally recognized. Such special methods of obtaining urine as suprapubic puncture, ureteral catheterization, etc., do not enter into the present discussion. The 2-glass test is misleading in women, as the first urine passed does not necessarily clean out all the vaginal pus. The old-fashioned method of examining the morning and night specimens of urine has been generally discarded in favor of the 24-hour specimen. Yet, in estimating the cause of nocturnal frequency of urination, especially in persons past middle age, a comparative quantitative examination of the urine passed between 9 p.m. and 9 a.m. and that passed between 9 a.m. and 9 p.m. is often imperative. Without it, one cannot decide whether nocturnal frequency of urination is due to the polyuria of arterial disease or to prostatism or some other local irritant. Thus, a complete laboratory urinalysis consists of 1. Chemical and physical examination, qualitative and quantitative, of a 24-hour specimen. 2. Microscopical and bacteriological examination of the centrifuged sediment of the bladder urine, obtained by catheter or by the 2-glass method. 3. In certain cases, a comparative examination of night and day urines.